with me here, we have Dr. Li as well for us for this special session. So let's wait maybe like 1 minute for the audience to join us first while we get things started, right? Dr. Li, I will just introduce the title for today first, what we're going to share. So it's actually about healthy habits for a healthy heart. So we're going to learn more about our heart health and healthy habits on how to build it as well. So I can see like people coming in. Maybe we will just give maybe another 20 seconds before we move on to the next one, which I'll be sharing about some housekeeping rules actually. So yeah, please do join us, guys. Like you can also inform your other colleagues to join our session as well for today. So okay, right. Let me go into the next one where I want to share about some housekeeping. So make sure that you are using a supported browser, either Chrome's, Firefox, Safari, or Edge. And let's say if you have trouble, try to re-log in again, or rejoin the browser again or refresh it. You can also test your speaker and make sure your internet connection is stable. So let's say if you have still issue, then you can just type at Naluri events where my team on the back end will help you out to solve the problem. And today we're going to have some poll as well. Rather than you asking us question, we're going to ask you question as well. So you can participate in the poll and share your thoughts. Let's say if you have a specific question either to me, myself, you can type out at Dr. Jasmin or to Dr. Li, you can type out at Dr. Li. Or if you want like either one of us to answer, you can just, generally put the question out. Or let's say like if you're shy or want to remain anonymous, you can send us a private message as well. And don't worry, this recording will be shared in your inbox later. You can either, rewatch this in Naluri website or YouTube channel officially. So today, let's start our session with introducing Dr. Li first. Dr. Li, do you want to introduce yourself to the audience?
Okay, thanks, Jasmin. Hi, everyone. I'm Li Ching here. Basically, I'm a cardiologist and physician at CBSKL, which is a heart-specific center. Nothing to talk about myself, actually. So I trained in Australia and Singapore, now back in Malaysia working.
Okay. Thank you so much for the short and sweet introduction, Dr. Li. So that's our, special guest for today's webinar. So I will just introduce myself. I'm Dr. Jasmin. I'm a general practitioner who have a special interest in preventive and lifestyle medicine. So I have experience with non-communicable disease such as diabetes, hypertension, high cholesterol, and I'm working with Naluri, working more towards healthy habits, behavioral changes, where we want to, either to control or reverse the chronic disease. So I hope that's short as well. So let's move on to the next one where we're going to see, some statistics about like today's topic, right? So before we go into further into detail, what we want to know also some statistic about in Malaysia and Singapore on how risk in our young hearts, the data that we should know about, right? So for Malaysia, as you can see, actually 29%, according to 2023 national Malaysian statistic data, 29% adults actually have hypertension, and 15% of adults have diabetes, and 84% of them actually undiagnosed between age of 18 to 29. So they are the young adults, right? Or from teenagers, they are going into adulthood. Similarly, we can see an increasing trends in Singapore as well. For hypertension, it rose from 21% to 31%. So it's like 10% of increase as well. And the control of the hypertension blood pressure reading as well is poor. And especially in Malay and Chinese group, then we can see increase in trend as well in dyslipidemia, which is high cholesterol, and diabetes as well. So you might wondering like why I'm sharing all this data is mainly because heart disease doesn't just appear overnight. It actually happened from our young age itself. It's mainly because of our habits and everything, right? So that's why we need to know some of this data. So now let's go into the next one where we want to look into what are the risks or what are the causes that will increase the risk of heart disease, right? So it will be divided into two parts of it, right? One is non-modifiable cause, another is modifiable risk factor. So non-modifiable is where we can't change, however we can monitor and also act early if we detect it, right? And for modifiable risk factor is something that we can change basically with our lifestyle intervention and treatment as well. So let's go into non-modifiable, which we can't change. So Dr. Lee, later you can feel free to add on after I finish sharing as well. Here, like as we can see, for age and gender is non-modifiable, mainly because as we increase in our age, for men more than 45 years old or for women more than 55, especially post-menopause, the risk of getting a heart disease increases. For gender, men has higher risk compared to women. However, women risk get higher as well, especially after menopause. It's mainly related to hormone cycle that we have as well. And also when you have a family history, like especially if your parents or sibling have a history of heart disease or heart attack less than 55 years old, so you will have a higher risk as well. Anything, Dr. Lee, you want to add on this non-modifiable risk factor?
Sometimes not being racist, but race plays a part as well, right? Certain race, let's say the Indians, have high risk of getting atherosclerosis, and that leads to stroke or heart attack. And also there are some genetic issues as well. So like the cholesterol, right? So there was something called familial hyperlipidemia. It means that you have the gene that produce extra bad cholesterol in the body, right? With something that you can't change.
Thanks for adding on, Dr. Lee. Yeah, especially about ethnicity for Southeast Asian, I do agree that we have higher risk compared to our other country counterparts. So yes, thanks for sharing that, Dr. Lee. So next, what we're going to look into together is modifiable risk factor, something we can change with our habits, lifestyle, right? So the first thing that I do want to share with the unhealthy diets. So sedentary lifestyle, according to a paper shared in Lancet in 2021, right? Sedentary lifestyle increase our heart event or heart disease by 147%. So that is very high. So that's why like physical inactivity and unhealthy diets where your high saturated fat, trans fat, your all your junk food, your processed food, fast food, it will increase your heart disease or risk of getting heart attack or atherosclerosis is higher, which will lead to heart disease as well. And second will be actually chronic stress. When you have a constant chronic stress, it will actually cause inflammation and also raise blood pressure in a long term. And third one will be poor sleep. So when we have less than 6 to 7 hours sleep, it can increase your blood pressure as well, because during your sleep, that's when your body will shut down and also reboot again, right? So that's why very important to have a good sleep. And next one is excess alcohol. I think alcohol, Dr. Lee will chime with me also, because it will increase our blood pressure as well as triglyceride, right? So if you are a chronic drinker. So this is some modifiable, and the next modifiable is which I want to share also is like, yes, as what Dr. Lee shared, our high cholesterol, it can be a genetic as well, but however it can be also something that we acquire as our sedentary lifestyle, right? So when we have like overweight or excess fat, it also can link to high cholesterol and also insulin resistant. And we can also get our high blood pressure or hypertension is mainly due to our sedentary lifestyle. It could cause damage to artery walls and leading to narrow and blockage. That's when you will like suddenly like have a heart attack without any symptoms, right? So similar for a high cholesterol or hyperlipidemia as well, excess cholesterol will build a plaque in your blood vessel, it cause the blockage or reduce the blood flow. And other thing is will be your high blood sugar or diabetes and smoking. And smoking is not just smoking, it's also vaping. So it's not just about like what kind of cigarette or what type of vape that you use. It still will damage your heart because of all the microparticles you are inhaling. So yeah. Anything, Dr. Lee, you want to add on this modifiable risk factor or non-modifiable risk factor?
Yeah. What I say is that sometimes, right, like cholesterol, diabetes, sometimes it runs in the family and you can't run away from it, right? But with the reason we say it's modifiable means that it's something that you can manage. You can manage your cholesterol, manage your sugar, manage your blood pressure. With that, that will lower your risk of getting cardiovascular issues, right? So that's what we call it modifiable.
Thanks for sharing that. Yeah, so with our lifestyle intervention and also a proper treatment, we can modify this risk
That's
factor.
right. Even those it might run in the family, but it's still modifiable. Right?
Yes, we can still control it.
That's right. Control that.
Yeah, we can control the complication, reduce the complication or risk of progressing of disease or complication of the disease itself. So that's why. All right. Next, I think this is something that Dr. Lee wants to share with others. Yeah, Dr. Lee, teen people don't have high cholesterol. What's your take on that, Dr. Lee?
Thanks, Jasmin. Okay. So this is the common things that we get from questions that we get from patients, right? Patient will tell me, "Look, I'm so thin, right? I will never get high cholesterol, and he's fat. He must be having high cholesterol." But we just want to make sure clear that size doesn't matter. So even you're thin, right? Even you're young, is potentially you have high cholesterol, especially those with strong family history. Okay, so size really doesn't matter.
Right. So remember, guys, even if thin, it doesn't matter. So
Yeah. So your
matter is
size,
right.
it doesn't matter also, right? So it's more important like you check it regularly because you never know.
All right. So regular routine medical checkup is very important in this case, especially to know whether your inner health, right? So, okay,
True.
next.
Yeah.
Let's
Just
go.
want to add on saying that you when you're high cholesterol, you have no symptoms. A lot of people think that if I experience giddiness, I got neck pain, I got muscle pain, means our high cholesterol is high. You have no symptoms means my cholesterol probably is normal, which is not true, right? So the size, okay, be it your age or even like no symptoms, it doesn't mean that you don't have high cholesterol.
Yeah, I totally agree with that, Dr. Lee, because for us to know high cholesterol, we need to do the blood test,
Yeah,
right? Because
agree.
these are one of the silent killer we always call, other than hypertension. High cholesterol is a silent killer because it will be no symptom, suddenly you have a complication.
Sure. Yeah, you're right,
So,
Jasmine.
all right, let's go into the next one. So, why we care so much about cholesterol, Dr. Lee? Why?
So again, this is another question that as a cardiologist we always get, right? Why do we bother to check cholesterol, right? Okay, I'm okay, I'm thin, okay, I'm still young. The chance of getting my heart attack is very low, and I have no symptoms at all. Why do I bother? So what? My bad cholesterol is 5. So what? My cholesterol is 3.6. So what I'm trying to say is like it's not that the number we're looking at, but we all know that from multiple research, by lowering the cholesterol, the chance of you getting a stroke or heart attack is going to be low. And also, the higher the cholesterol, the higher the chance that you're going to end up problems. So that's what we care about it, right? So it really predict the risk. Okay, and we know that by modifying it, by treating it, the chance of you getting you running into trouble will be lower. Okay.
I also totally agree with that point, Dr. Lee, because the reason why we care about cholesterol is not just like good cholesterol, bad cholesterol, or triglyceride. Right? We care the whole profile is because it will help us to predict your risk of getting not just heart disease but also stroke. So that's why we care about it, and we encourage you to do a routine checkup for it as well. So yeah, and
You're right,
next,
Jasmine. Yeah.
so I think this is another famous question that always comes
Yeah.
to myself. So, uh, does changing my diet improve my cholesterol, Dr. Lee?
Thank you, Jasmine. Again, this is a common question that we get every single day, right? Okay, for some reason, everybody don't like medicine. So, right, even though we know that the benefits of taking cholesterol medicine, I'm not saying in all patients, right? It's certain group of patients especially, right? Cholesterol medicine does help, but unfortunately, people say, look, it's cholesterol medicine. No, 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 I'm not going to take it. Can I try on diet? Can I try on supplements? Right? Let's start with diet first, right? We know that diet will not affect 20-30% of your cholesterol in the blood. Then the other 70 to 80% of the cholesterol actually is manufactured by the liver. You no control over it, right? Your liver will continue producing it. You cut down your fatty food, your pizza, your burger, your donut, right? And deep fried stuff, nasi lemak. But you only probably manage to cut down 20-30% of the cholesterol in the blood, right? Liver, sorry, you still have to take some medicine to help the liver to help the liver from producing less of the bad cholesterol. And bear in mind that exercise would only increase the good cholesterol. It does not decrease the bad cholesterol at all, right? So usually when we come to treating patients, we're looking at the bad cholesterol more than the total cholesterol. So patient will tell me like, look, my total cholesterol is 5.2. Then my good cholesterol is 2. My bad cholesterol is also 2. It means that okay, my good cholesterol probably is 2.5 or so. My bad cholesterol is 4. Okay, sorry, a 3. Right? So does it mean that my good cholesterol will counteract the bad effects of bad cholesterol? Does it mean that I don't have to take back the cholesterol medicine, right? By exercise, probably I increase my good cholesterol even further up, then will counteract the effect. Answer is no. You, regardless of it, good cholesterol will be improved by exercise, but you still need some medicine to lower the bad cholesterol. Okay, alcohol. I'm sure not everybody here drink alcohol, and a lot of older Chinese people will tell you that, look, I drink a bit of alcohol, I live longer. It's quite well, I wouldn't say a myth, right? A common belief, but we all know that even drink just moderate amount, not too much. Okay, and moderate amount of alcohol will actually help to raise the good cholesterol a bit, but it will never lower the bad cholesterol. Okay. Similarly, smoking also to improve the good cholesterol. By quitting smoking, it will improve the good cholesterol, but won't decrease the bad cholesterol. Sorry, Jasmine. It sounds very confusing, but what I'm trying to say, like, whatever it is, medicine is important.
Thanks for that. I think like what Dr. Lee's key take is like medicine is important beside the lifestyle intervention, right? So it's like it's not just medicine or lifestyle intervention only, but both need to go hand in hand to make it better result of reducing cholesterol. So I hope that's clear for the audience there.
Yeah.
So
I think the take home is that medicine is important. Diet only cut about 20-30% of bad cholesterol, and exercise would only improve the good cholesterol. I think that's good enough take home message.
all right, thanks for that summary.
Right.
All right, let's go into more a bit of debunking. I
Eggs.
think this is a famous one, Dr. Lee.
Yeah,
This is a famous one. Everyone will say, oh, if I eat egg, my cholesterol will increase. Or if I take yolk, it will increase some more. So,
that's right. I will go for egg whites. Okay. Yeah. Just want to say that with all the research has been done, right? There's no evidence by eating eggs will increase the chance you getting heart attack or stroke. In fact, the egg yolk is full of nutrients and micronutrients, and it's a good source of nutrients, and we shouldn't avoid eggs.
okay, thanks for that.
Okay.
I think it's actually like more to a question of like how much of egg or calorie that you will take per day, right? So I think that's the more what we need to do is moderate amount. So that's what we need to focus on rather than you are not taking the eggs at all. So
True.
all right,
I think 1 to 2 eggs a day actually is okay.
oh, see, Yeah. So 1 to 2 eggs a day is okay for us to consume
Yep.
without any fear. Yeah. So I think we have another debunking for our cholesterol medication. So this one is like more of sharing. I think like Dr.
Yep.
Lee, you want to share?
Okay. I think years ago, everybody would have received lots of WhatsApp messages or emails concerning statin. Okay, statin is a common group of medicine we use to treat high cholesterol, right? And when I say statin, including like simvastatin, lovastatin, rosuvastatin, atorvastatin, the trade name was something like Simcor, Crestor, Lipitor, right? So the side effects, you want to look into it, you have pages and pages and pages long. So what is important to know is that what is the rate of this complication, right? So the side effect of statin actually is very low, probably less than 0.5%. And everybody is worried that whether statin will cause a liver problem, statin will cause a kidney problem. What I can tell you is like statin does not cause kidney problem, but it does increase the risk of a liver issue. Again, but the chances 1 in 100,000, and usually the first 2 weeks after you start the medicine. And now, even nowadays, right, even the guidelines say you don't have to monitor the liver function anymore. So it's actually a very safe drug.
I think like we have like more and more research data to prove that. So yeah, we need to look into the scientific evidence rather than worry about 1 in thousands side
Yeah,
effect that we're going to get, right? So,
yeah.
thanks for that, Dr. Lee. So I think next we're going to like ask more question to audience to get their understanding. Maybe we can get the poll out to ask this question. I don't need medication for my cholesterol. I can manage my cholesterol with diet and exercise. So this is kind of a like a testing for you. Natalie already shared her view on that earlier. So what's your take? Okay, maybe we will wait until 60% of the audience answer it, then we can close the poll. Yeah, we already have 23% of audience answer it. So more guys, like, what your take on this? Is it yes, I don't need medication for my cholesterol, or no?
I love people answering yes.
It's like it's almost going to tie actually, like.
I think we
So
need to make ourselves clear, right? It's a bad cholesterol or the good cholesterol.
yes, I think earlier if they actually like really listen to your earlier sharing, I think they will know the answer already. So okay, maybe we'll wait another like more than 50%, Dr. Lee, before we share the
Sure,
answer to the audience.
sure.
Okay, now we are at 43% of audience answer it already. Like, can we have a bit more? We have 200 people here, guys. So let's get more answer to this.
Yeah, lots of people answering.
Yeah, now I think there's oh, now it's tie. Oh wow.
Oh, wow.
Okay. Just now it was tie actually.
Yeah. I guess nobody likes medicine.
Yes. So okay, now we have 51% of audience answering. Maybe we can relieve the share the answer Dr. Lee.
Okay, like I said, I'm so sorry because we didn't make ourselves clear enough. So we'll try to say that aside. Do we need to take medicine for bad cholesterol? And as discussed earlier, diet alone is not good enough, right? Diet alone will probably lower the bad cholesterol by 20-30%. Okay, and exercise will only improve the good cholesterol and won't lower the bad cholesterol. Okay, so answer is no. You need medicine if the cholesterol is high.
Yes.
Okay, also, yeah,
So I think like what Dr. Lee like stressing it here is actually depend on your LDL, which is the bad cholesterol level, and total cholesterol level, to for us to know that diet only, medicine with diet and exercise or lifestyle intervention, right? So we actually need medicine to lower the bad cholesterol, right? diet and exercise does help, but only to certain percentage. That's why we need help from medication to reduce our bad cholesterol or reduce the risk as well, right? Dr. Lee, to risk of getting our heart attack or stroke as well. Right. Next, we will have a second pull up. So this is similar as well. I don't have high cholesterol, so I will not need medication. So is it true or false? It's similar but tricky question. So we will wait for at least 50% for audience to answer this. So I don't have high cholesterol, so I will not need medication. Is it true or not? If your relative or like your friends that have experienced some heart disease or stroke, you might know this answer. But it's okay. We're going to share soon. What's the answer? So another 6 more percentage of the audience for us to know. Okay.
Everybody's very actively say yes.
I think majority is yes.
Yes. Yeah.
77% of the audience say yes, I will not need medication. so
So maybe the question would also say why people think that they don't need medication. And people asking, since I don't have high cholesterol, why do I bother? I think that's important.
Yeah. I think maybe next time we can add that question as well.
Sorry, guys. We should add a lot of caveats.
Yeah, we should add another question to make it a bit clearer. Yeah. Okay, I think we have a winner. 78%, okay, 77% of audience say yes. So,
okay. So basically, right, the question is that I don't have high cholesterol, so I will not need medicines at all. So then we should come to the definition of high cholesterol, right? So we know that we always look at the bad cholesterol. We don't really look at total cholesterol per se, but there are more scientific evidence that by lower the bad cholesterol, the lower the chance you're going to get a heart attack or stroke or so-called atherosclerosis, right? So high cholesterol definition usually means that it's a high LDL level. And also depends on your risk profile. Everybody's target is different. For somebody, LDL level of 2.5, 2.6 is high. It's not good enough. For somebody, LDL level of 2.6 is good enough. Example, let's say you had a heart attack with the underlying blood pressure and high cholesterol, with the underlying diabetes and high blood pressure, but your LDL level is only 2.6. In this sort of scenario, even though your cholesterol is not high, right, you will need medicine. Okay, we'll come back to this later. Let's say you're a young, fit person, non-smoker, no family history of ischemic heart disease, no sugar problem, blood pressure is okay, no symptoms at all. At a cholesterol level of 2.7, 2.8 is really acceptable, right? You don't need medicines at all. Go back to the first scenario. So you're diabetic, you have high blood pressure, you recently had a heart attack. So your target cholesterol level should be less than 1.8. So 2.6 is not good enough. So in this scenario, you will need medicine. Let's say you got recurrent heart attack and have multiple stents implanted. Your LDL level required, like target LDL level, should be less than 1, right? So the definition of high cholesterol is different in different group of people with different risk profile, right? So,
yeah.
am I very confused? I think so.
I think it might be a bit confused, but maybe I can clarify again. So, like what Dr. Lee was sharing also is actually related back to the modifiable and non-modifiable risk factor that I have shared. So if you have no risk from the risk factor that I shared, then your cholesterol although it's slightly LDL is slightly high, it's still acceptable because you don't have any other risk factor. However, if you have one or two of those risk factors, right? Like for example, you are smoking, you are drinking alcohol, or you are actually have a diabetes or hypertension with smoking, then your target of LDL level, it will be individual target that we want to do because you have higher risk of getting the complication of heart disease as well as stroke. So that's why like when it comes to LDL or cholesterol, it actually an individual one that we want to look into based on the risk factor rather than a generalized one. Did I summarize it correctly, Dr. Lee?
In a way, it's true, but I just want to stress that depends on your risk profile. Your definition of high cholesterol that for that particular individual is different, right? So it could be less than 1, less than 1.4, less than 2.6, or even less than 3.4, right? So it all depends on your risk profile.
Yeah, especially if someone actually have a history of a previous stroke or a previous heart attack.
Yeah.
So I think their target of LDL will be much more stricter. So
That's right.
all this according to the scientific research as well, why we are putting a different target for each. Yeah. So yeah, it not necessarily that you may not need medication, it back to your risk factor. So okay. All right. Next, I think we have another poll, which is statin, which is high cholesterol medication commonly used, can lead to liver and kidney damage. Is it true or false? Maybe we can get the audience to answer this as well. So if you
I think
actually
it's
like, yeah, if
a
they are
obvious
actually like
question.
attention to Dr. Lee just now, so they will know the answer.
I don't think anybody will get these questions right.
Okay. I mean, we have percentage totally, so we shouldn't assume. Maybe it might be a bit lower, but I think people actually pay attention to what we have shared. So we can see that okay, like 30% of the audience answer. So 53 said yes, and 47 said no. So some are listening to what we have sharing so far for this past 30 minutes. So okay. All right. We will just wait until we have 50% of audience again. We already hitting 39%. So another 8%, guys. 42% percentage already. So a bit more. Okay. Like this is kind of a testing also the knowledge as well as whether you're really paying attention to what we have sharing so far. So yeah. Okay, another 4 more percentage of poll. Can we get a bit more from the audience? Okay, if okay, I think maybe we can just make a conclusion for this. So,
Yeah.
actually, like 55% of the audience say yes, statin can lead to liver and kidney damage, whereas 44% say no.
Okay. I think there's no right or wrong answer in this question. Sorry about it, guys. Statin, like we said earlier, can potentially cause some liver issue, and the percentage will be 1 in 100,000 chance. So it's very little, and usually happen the first 2 weeks after you start on the statin. And statin does not causes kidney problem, right? It might cause some protein in the urine, but it does not causes any kidney damage at all. So even though you're on dialysis, you say can all go on the statin, right? So there's no right or wrong answer here, but it's just nice to discuss because this is a common questions that people will ask, right? And one of the common reason why people refuse to take medicine because it's always a myth that medicine or especially statin will cause liver and kidney damage.
I think this is a good discussion for always like a common question that patient will come and ask, right?
Yeah, yeah.
That thinking, oh, I will have a kidney damage, a liver damage. And you
Yeah.
might also wondering if you go to clinic kesihatan or, like some of the clinic, when you just started, they always ask you to come, okay, within 2 weeks or 3 weeks, come back. We need to check your liver function, right?
Yeah.
It's mainly because of the, like, there's a chance that it might affect your liver, but however, it's a very less chance, right? So, yeah. So that's why it's this question actually is a trick, but it's more of a discussion. But always, it's a common question people will ask actually.
Sure.
So next, I think what I would like to share, maybe later, Dr. Lee going to add on, as well as like the lifestyle heart connection, formula that we call as HEAL. So, from healthy diet, yes, medication is important to lower the bad cholesterol. However, we also shouldn't neglect our lifestyle, which is our healthy diet, E for exercise, A for adequate sleep, and L for less stress. So that is HEAL. So the reason why this is important is your heart actually listen to your habits every single day. Either it's the sleep, stress, movement, physical activity, or nutrition. It's not just nice to have, but they also directly link towards your heart health as well, which will affect your blood vessel, heart rhythm, metabolism, and also it will increase long-term risk of getting the complication. However, like one thing that we need to note that even a small change or healthy habits will make a measurable difference. For example, patient who just lose 5 to 10% percentage of their body weight can saw a significant reduction in triglyceride, total cholesterol. However, this actually will relate back to their lifestyle as well medication together, right? It's not just lifestyle on based on their risk factor. Yeah. um, Next, like what I want to dive deep into is the heal, which is like we're going to start with nutrition, which is healthy diet, right? So healthy diet, as you can see, is actually um, you know um, your risk will increase. As I mentioned earlier, if you eat more processed food or junk food high in sodium, which will increase your your blood pressure level as well. And also all these processed trans fats that you are eating, consuming will increase your bad cholesterol. So when you improve or work on this nutrition or healthy diets, especially like when you focus on, when you actually recall what Dr. Lee shared, is when we eating healthy food, balanced diet, where we are more like following our suku suku separuh concept or healthy plate, more veggies in the half of your plate, which will also reduce the cholesterol level by 20 to 30%, right? So that's very important. The next is your exercise in HEAL, which is your movement. So the recommended movement that we all should be doing is 150 minutes, like a moderate exercise in a week, right? However, how many us was actually doing it, right? But that is the one of exercise or movement or physical activity will help us to increase our HDL level, which will protect our heart as well, right? That's second one of the HEAL formula. And the third one of the HEAL formula is actually adequate sleep. So when it comes to adequate sleep, I think research or also paper from American Heart Association in 2022 shared that if you have less than 6 hours sleep per night, it will actually increase your heart risk by 20 to 30%. So that's why it's very important to have a proper adequate sleep as well. So make sure you get like the recommended sleep for adults, which is 7 to 9 hours, which will improve your BP reading and improve your metabolism, which will like help with glucose metabolism as well as your cholesterol as well during your when you're sleeping, right? And the last, which is L of HEAL, is less stress or stress. So I think the stress is very important component here. I think, like according to European Heart Journal, it actually mentioned that chronic stress it will increase your blood pressure and also inflammation. So because of mainly, it will trigger the cortisol hormone, which is your stress hormone, and also adrenaline, which will have effect on your blood pressure, and all this will have like a effect on your heart health as well. That's why very importantly, you need to actually focus on your stress management as well. So be apply some relaxation activity and also mindfulness, which actually proven by some data as well. It will reduce 4 to 5 milligram per mercury of your BP reading as well. However, you need to be consistent with this kind of mindfulness and relaxation activity. So that's the heal formula that I would like to share. If let's say if you want to incorporate your healthy habits to reduce your risk of getting high cholesterol or heart disease, right? But let's say if you already have high cholesterol, but if you want to incorporate habits, so these are the habits that you can work on other than your smoking. You need to reduce it. It will be good if you actually stop smoking, and also alcohol consumption. You need to reduce it, and there's a recommended, which is one drink per a week. Yeah. All right. Dr. Lee, anything that you want to add on to the audience regarding
No,
this?
I think that is very comprehensive. Thanks, Jasmine.
All right. Thanks for that, Dr. Lee. And next, I think this is something that we want the audience to do as a next step, Dr. Lee. So a practical framework to build a healthy habits, right? So 3 steps to make your heart habit sticks, right? So we use this 3S method. Start from small, stack it, stay consistent to make the healthy habits more realistic and also achievable and lasting for you. So when you want to start small, maybe you can pick one action for today, right? For example, instead of drinking sugary drinks, you actually replace it with plain water. So that's one action, right? And second action is like what you can stack on this drinking plain water is where you can actually do 2 minute stretch, or even do a 2 minutes breathing exercise after a walk or something. So you add on another relaxation activity. And the third one is actually stay consistent. So stay consistent with these small habits so you can build more healthy habits, and it will actually will give some improvement that you can see in whether your overall health or even blood test wise, right? So that's why it's very important. And remember, always keep us a celebration of small win. So even let's say one day you fall back, as long as you're moving forward with your healthy habits to tackle your cholesterol together with medication, everything. So it's very important to stay consistent with healthy habits and also medication adherence. So I think that will be my last take home message that I want to share. But anything that Dr. Lee that you want to share to the audience as a take home before I go into the resources?
No, I think staying consistent is important because no point going for a crash diet and a weight loss of 5 kilos or so in a month or so, and then after the month after you start binging. That doesn't help at all.
So I think stay consistent with our
Yeah.
small healthy habits, and stacking up is very, very important. So you can start small, but you can stack it up your habits and stay consistent with it. So yeah, next, I think what I want to share with the audience is some of the support and resources that are available in Naluri. Let's say if you want to know more about your physical health, you can scan this QR code where you can actually know your physical health risk about your overall health, and it's actually free. And you also can talk to a medical advisor from Naluri app who will attend to you after you take this physical assessment. Or let's say you are actually with Naluri, you have a consultation slot and everything. You can actually book a session with our Naluri physical health coach, either a medical advisor, a doctor, or a fitness coach, dietitian, even mental health coach for all of the support that I have shared, right? Either if you want to work on your fitness, diet, or even your mental health to work on your stress, you can book a session with one of the health coach there by scanning this QR code. Next, let's say like if you haven't downloaded or don't know how to download this, so maybe you can actually like click on scan this QR code to download the app or visit the website, right? So these are the few things that you can look. But other than that, in Naluri, like maybe some of you who are already using it, you know that we actually provide 24/7 support in case if you need any urgent mental health support or mental health issue that you want to raise up. We also do this. And next, I think about your emotional well-being. So we are not just focused on physical health. We also like look at you as a holistic being, where you can also do this assessment, emotional well-being assessment, to get more about your current mental health. Then you can talk to your mental health coach regarding this as well. So there's other resources that we have. But let's say if you want to stay connected with us, you can reach out to the Facebook or Instagram. So in Naluri now, like while we are waiting for question, maybe we can get the feedback form out for us to know like what we have done well, what we can improve for the next session, so we can learn from it as well. So we'll appreciate the feedback from the audience. Now, I think Dr. Lee, let's go look into the questions. So maybe
Sure.
I will read out the question first. We have quite a bit. Okay, maybe I will scroll it up. Okay, all right. We have a question from Arman. How about sleep pattern? Does it consider as a risk factor? So, Dr.
You,
Lee, did you
you
answer or?
okay? Can so basically, we want to have a proper good night's sleep, because as we know that if you don't get good night's sleep and then you get stress also a cardiovascular risk factors. On top of that, that will push up the blood pressure. That doesn't help either.
Yeah.
Okay, so good night's sleep is important.
Yeah, I think just to add on that as well is about what Dr. Lee said is actually good night's sleep per night and proper duration is very important. Your quality of sleep is very important because that's when your body do all the restorative work. As I shared early, we actually have like around like 30% of risk if you don't have a proper sleep to get heart disease and everything. So I think we have a second question from Sarini is, does exercise help reduce cholesterol? I think this is something Dr. Lee already shared earlier, right? Dr. Lee is,
Yeah.
yeah.
So it
So,
does, the exercise will improve your good cholesterol. Okay, it does not decrease the bad cholesterol. Sarini.
yeah. So I think for us to work on the cholesterol, the bad cholesterol, then we might need to look into the medication as well as diet and other lifestyle as well. So, yeah, and we have another question by Shin Yi. So my mother was recently diagnosed with three blocked arteries. One is 90%, one is 50%, another one is 15%. The doctor recommended angioplasty. How serious is this? Does this mean she need to do the procedure immediately? If the surgery has to be scheduled, what is the usual safe timeline? So
Okay.
I think this question I will leave it to you, doctor, because you
Okay.
are more experienced with the cardiologist part. Yeah.
Hi, Singy. Sorry to hear about mom. So it's very hard for me to answer the questions because we all know that everybody has three blood vessels, and anything that usually anything that more than 70% above is significant, right? So 90% obviously is significant, but again, it's very important to look at the location. We need to know whether it's at the top of the vessels or at the end of the vessels. Okay, and also the 50% as well, if at the very top of the vessels, and it could be important. Okay, so 15% usually isn't, it's not that bad. Like a lot of people have like 10-15% of blockages everywhere, but it's very hard for me to comment without looking at the angiogram. I really need to know need to look at the diagram or the moving pictures myself, see how bad the blockage is, whether it's just one spot or the whole thing is already diffuse, or whether it's at the end of the vessel or the top of the vessels, and need to know whether mom's heart function is okay or not, or whether she has other risk factors, whether she has kidney problems, and all these things need to be to be looked at before I can answer you. I mean, if you like, you can always send to the team, and they can send the detail, send the mom's detail to me. I can answer you privately.
I think if you would like to have a second opinion, maybe you can reach out to Dr. Lee separately on this, because
Yeah.
it's not just about this information, right? Dr. Lee is actually about the patient. I mean,
That's
your
right.
mother's whole. We need to look into before we decide what will be the next best step as well. So, all right. So, okay, I think next question is there is actually a question from Sari. Hello, doctor. How can I reduce or decrease my sugar addiction?
I think
Okay.
Jasmin, you have to answer this already.
I think yeah, I think this to my forte already. But thanks for the question, Sari. So about sugar addiction, something that I would like to ask also will be like some of your background about your health, and also your um how's your eating habit, diet, as well as exercise, all this, because sometimes when you actually eat more carbs, you might actually tend to have or crave for more sugary or carbs related foods, right? Because the reason why is when you eat like carbs or sugary, your energy will like diminish very fast, then you will crave more. That's why there is a sugar addiction, right? But however, it also like we might also need to look at your overall health, like how's your sugar level and your BMI and all the others, so for us to know that whether like are we going to tackle just one part of it or the other. Yeah, so it's not just one part on how to tackle the sugar addiction, but we have to look at the other holistic lifestyle as well. So yeah, but if you want to tackle that, please reach out to me or dietitian in the Naluri app. We'll work on it. Yeah. I think we have a question by Samsia. Each one of us require the same number of hours quality of sleep to stay healthy, regardless of our gender, age group, extra. Notice that as I grow older, sleeping more than 5 hours is almost impossible. If I force myself to sleep in, will wake up with a headache. Thanks for these questions, Samsia. So, Dr. Lee, you can add on later if I miss anything. But
Sure.
for sleep, it actually depend our age group, mainly because we do have our recommended sleep pattern by our sleep association or foundation, where it will for the age of 20 to 50, we actually recommended our sleep from 7 to 9 hours. However, when you age more, the recommendation of sleep will reduce from 6 hour or 7 hours, so it will be like 5 to 6 hour or less, right? It will reduce as we age. So the reason why is like I think your headache is like we can tackle it separately, but what I will ask is when you actually have this 5 hour of sleep, do you feel refreshed? If you feel refreshed, then you have a quality of sleep, right? But if you don't feel refreshed, I think that's when we want to work on your sleep, either your sleep hygiene or your sleep routine, which might help you to reduce this headache and everything. Yeah. Dr. Lee, anything that you want to add up?
No, I think that's pretty good actually.
All right.
Yeah.
Okay. I think there's a question by Mala. I think it's regarding the eggs. So
I think question by
what
Singy also eggs.
Oh yes, yes. So there is a similar question. So I think what they ask is like, is it 1 to 2 eggs per day is applicable for everyone or depends, right? So and I think but Shini is like my mother recently diagnosed with three blocked artery disease. Can she consume 2 eggs including yolk every day? Soft boiled egg.
Okay.
So
Like I said, it's all depend. In general, it's okay, but especially in kidney patient, you can be careful because eggs is full of protein and also have phosphate as well. Okay, so yeah, so it's all depend, especially in kidney failure patient.
alright. So
Yeah,
I think like
so so it's best to check with the kidney dietitian.
right. So whoever that have experience in kidney disease, then they will know what is the recommended one. But generally, yes, 1 to 2 is
Then yes,
yeah. All
I'm
right.
so sorry. I need to sort out something. So We saw about the what first. Sorry, just 1 minute.
All
Jasmin,
right.
you go ahead. I'm so sorry.
No worries. No worries.
Sorry,
I think
sorry.
there's something urgency that urgent thing that Dr. Lee is doing. So maybe I'll go on with the question first. All right. Okay. Where is it? Okay. How high LDL need medicine? Thank you for the question, Lipar. So, as we have discussed earlier, the LDL level that cutoff is 2.6 or less. That is the cutoff for normal. However, it actually depends on the risk factor as well. Let's say if you have a risk factor of hypertension, diabetes, then we might start off you with your statin medication because you have a high risk of getting the heart disease, right? However, let's say your LDL level is high, but you don't have other risk factor, maybe we might not consider you to start on the medication first, but we'll focus on lifestyle intervention first. So it actually will depend on your other risk factor to mention that it is high. But however, on a, like a generally, if your LDL level is more than 2.6, is high. So yeah, that is the general cutoff. All right. Was answering the LDL level
Oh,
question.
okay. Sure.
Yeah, they were asking like how high LDL level need medicine. So
Um,
I asked like it's depend on the other risk factor, right, Dr. Lee?
yeah. Not really depends on other risk factors also, but it depends on whether you have chronic artery diseases or whatever. Let me see whether I can get a picture up and upload in the chat box there. Okay. So
Right. So it's actually about your risk factor of the modifiable, non-modifiable, and also like risk of getting a stroke or a heart disease as well. Okay. All right. I think there's a question, another question. We will just take another two questions, then we will end it because we have almost less time already. Could you please share the risk profiles again? I joined a bit late by Mala. Mala, don't worry. We're going to share the whole the slide as a PDF and also the recording to you later. However, you can also access it to via Naluri YouTube later, so don't worry. Yeah. All right. I think we will go into another question by Michelle. Will HDL higher than normal benchmark can create another issue, but LDL is below the benchmark normal. So usually when Dr. Lee, you may also chime on this, right, Dr. Lee? Like when you have high LDL than normal, it actually is good. It protect the heart. However, I think there's also a cutoff for HDL that if I'm not wrong, it shouldn't go more than certain number, which I forgot, right? Yes. It also when your HDL high and LDL is low, it actually protect your heart. But then the LDL, is it low with no risk factor? That's another thing that we might need to discuss as well.
yeah. So sorry, I'm trying to get the Malaysian guideline and show everybody, but unfortunately I couldn't do it. But I'll do it shortly. So back to the LDL, how the interpretations of your blood test result. So when you get a blood test result, right, there's always come the total cholesterol, triglyceride, the HDL, then the LDL, and then also there's a ratio as well. First thing, we don't look at total cholesterol. We don't look at the ratio. We usually go for the LDL first. So reason being, most of the studies or most of the evidence are on LDL. We know that the lower the LDL, the lower the chance you're getting heart attack or stroke. Okay, the lower the LDL, if let's say you had a bypass done or a stent done, the lower the chance that the stent will clogged up or the new graft will blocked up or blocked. Okay, so we treat the LDL first. Usually we reach the target LDL, then we treat the HDL. So for HDL, usually we want it more than 1. Okay, so and after we treat HDL, then we look at triglyceride. That's how we usually go for it, unless the triglyceride is very high. Okay, at the start, then we treat the LDL and triglyceride at the same time. Would that be okay?
Right. Thanks for sharing that. I hope that actually answer, the question that asked by the audience. So, okay, all right. I think we are actually right on time for today. So, okay, sorry, couldn't answer some of the question, but yeah, we already like on time for today. If anything you want to know more, we can actually reach out to the medical advisor in the Naluri chat as well, so they will explain about more about this heart health and also about your diet, like diet related, fitness related, or mental health later. So please reach out to the respective coaches in our Naluri app as well. Thank you so much, everyone. Have a good day and. Thank you. Any last word from you, Dr. Lee, for the audience?
No. Take care, everyone. And I think, Singy, if you like, you can always uh, talk to the team and send me the images of your mom's angiogram to me privately. Take care.
All right. All right. Take care. Take care, everyone. Have a good day. All
Bye.
right. Bye.